Greetings, everyone. Welcome to the 227th session of the online Optom Learning Series, or OLS. And for today's session, we have with us Dr. Shirley Loh. Dr. Shirley is a clinical optometrist. She holds an undergraduate as well as a postgraduate qualification from the University of Melbourne. She has over 2 decades of experience, I would say a diverse experience. She has worked in retail practices, in public health, NGOs, corporate optometry, and also she served on some mission vision trips, I would say, to help the underprivileged in indigenous populations. She's a well known speaker at the Asia Pacific conferences and also worldwide on the topics of evidence based practice and also on the contact lens technology. She is a professional education lead for Johnson and Johnson Vision for Southeast Asia, India, Taiwan, Australia, and New Zealand. And she leads the training program where she collaborates with health authorities and enhances the eye care standards, and also responsible to raise public awareness for certain eye conditions and doing propagation for the profession as well. Previously, she also held roles at the Optometric Associations in Australia and also at the Singapore Optometric Association Council. So with all that vast experience, when we reached out to Dr. Shirley, she said, "I'll not do one talk. I'll do a series of talk on the topic which she likes, where she's going to talk to us about holistic eye care, and this is going to be a series of session we have planned, and you will be receiving details on when the next sessions are happening." So thank you so much, Dr. Loh, for joining us today, and let me just leave the screen time to you, please.
Thank you, Fakrudin, and a big welcome to everyone. Good afternoon, good evening, good day to some of you, depending on where in the world you are. And as Fakrudin mentioned, I'm Dr. Shirley Loh. I've actually graduated from the University of Melbourne and have my therapeutic qualification from the University of Melbourne as well. So, and again, a big thank you to OOLS. I'm really very honoured that this is the 227th episode, and we continue this whole episode with that same vision to have lifelong learning alongside with holistic eye care. So let me just move ahead. Today we're covering quite a few things, right? Different topics when it comes to every patient having their own unique process, their own life journey when it comes to their ocular development, how they optimize their vision, maintenance, and preventative care. Each of these topics is very, very comprehensive. If you really want to get even to the next level and be deeper in your knowledge and understanding, help your patients in a new way, I'm hoping this session will help you today. Okay, I'm just going to share a bit of background about myself. So actually, I'm the youngest one here, smallest child of a family of 4. And my mother was from Malaysia and my father was from Singapore. And so I'm actually very much Southeast Asian. And then they migrated to Australia. And so I have a bit of Singapore, a bit of Australia in me. I'm currently residing in Singapore and currently having experience and meeting experienced ECPs from all over Asia Pacific as well. And with this knowledge, I would like to share some of the experiences that I've had and also blend it with my own unique perspectives on what I find extremely dear to me, which is holistic care. So hopefully you'll feel that passion come through as I talk about this, and perhaps give yourself a new perspective on how you may approach not just your practice, but life overall. So moving ahead with that one. Today's agenda, I'm actually going to be covering what is holistic eye care, maintaining good vision throughout life, optimizing vision, molecular mechanisms of eye aging, and following up with a development plan as well. So let's start the conversation off with what is holistic eye care. Some of you have heard the term potentially Some of you may think of the word of holistic as a bit out there, a bit left field, something that isn't conventional and may or may not work. But in fact, it's not really something to be alarmed about or scared about. In fact, the whole of modern medicine is actually leaning towards this way, because we realize being holistic is actually taking the whole person into consideration. And everyone is different, everyone is unique, and this is something that we have to keep in mind as a practitioner, even though the presentation may be similar to something we've seen before. All the underlying factors, all the different lifestyle and vision needs come together in this unique situation for this individual. And this is how I like to approach patient care as well. At the most simplistic way to look at it, it could be something like making sure we look good, see good, and feel good, especially in our eyes. And as eye care practitioners, this is something we tend to do as we go through our routine, whether it's all the way from history to the slit lamp, anterior eye health, posterior eye health, vision checks as well. And the crossover between all of them is where we find optimal vision. But I would prompt you to actually have a new perspective on this. And it's not just the eyes looking good, seeing good, and feeling good, but can they look great and see great and feel great, even better than expected or desired? And as we go through this talk, I'll actually challenge you to think about, it's not just the eyes, but ensuring that the body looks great, feels great, and performs great. Because obviously the eyes are a part of the body. They can't function without the support of the rest of the body. And as you know, there are systemic systems such as the cardiovascular system, which very much affects the health of the eyes as well. So keeping this in mind, this whole approach will need to broaden our scope as eye care professionals to look at different areas that we typically may not have covered before, but I believe will become more and more common in this world of eye care, because we can no longer separate the eyes from the body. Now we can just perhaps have a bit of discussion. So we talked about looking great, seeing great, feeling great. So I hope everyone can join in today with a discussion. In what circumstances can it be possible? For example, the eyes feel fine but see poorly. Anyone put their answers in the chat? Let's have a look. Any examples of that? Let's see if anyone can come up with these. Everyone is shy today. Feel free to chat and ask questions, by the way, at any stage. Okay, so if you haven't thought about this before, many of our common aging eye conditions, the eyes may feel fine but see poorly, right? So we're talking about things like cataract, like AMD, age-related macular degeneration, or glaucoma, many forms of glaucoma, not all forms of glaucoma. So the eyes feel perfectly fine. And of course, that's one of the key problems, that the eyes do feel fine. Of course, when you have sore teeth, you're not going to avoid that. You'll have to go to see the dentist. But of course, when it comes to vision, the eyes can feel perfectly fine, but you can start to see poorly, and you may or may not be aware of it. And obviously, that's the scary thing about eye health and preventative care. Okay, so no comments. Let's go on to another question. The eyes can see well, but feel terrible. So is this possible? Any suggestions from the audience? So either you're all very new, all very shy, or just waiting for the answers. I'm sure you've seen some of these types of conditions as well. Okay, well, we could cover things like, we do have one of the chats. Let's see what we have today. Dry eyes, very good, great. Dry eyes, allergic eyes, to a point, right? So sometimes there's a point where dry eyes can become so terrible that it does start to affect vision. but then again, it may not always be the case. So we do need, these are just examples of how we do need to take care of all those three aspects of good health. Okay, and one more. Okay, have great visual acuity but poor vision. This may be a little bit confusing. Okay, accommodation access. Very good. Yep. So perhaps any of the binocular vision problems. Yes. And things like, poor contrast, poor color vision. So, and it depends on the person's hobbies. So if a person, for example, needs to sew or likes to sew at night and, she can't quite, thread the needle because of the poor contrast, then, but she still may be able to get a good visual acuity on the chart, then yes. Post-LASIK, yeah. So post-LASIK can cause those sort of contrast issues as well. And sometimes even the IOLs. So depending on the type of IOLs, there's been some feedback and reports of certain types of multifocal IOLs causing a reduction in contrast. And this isn't perhaps understood or explained to patients before they get their surgery. And it's only after the surgery that they then realize, I can, my doctor says I'm seeing well, I'm seeing 20/20, and yet I don't feel like I'm seeing as well. And so these are, multiple factors that do come into consideration. So thank you for those answers there. Great. So obviously, having a holistic approach means we need to look at all of these things. As we move a little bit deeper, holistic eye care does take the need of having a healthy, optimized, and knowledgeable patient. They know actually what decisions to make that's best for their eyes. But of course, I believe that it also takes the factors of a healthy, optimized, and knowledgeable ECP as well. Because if we're going to be guiding our patients and we're going to be understanding all their lifestyle needs, and there's many different aspects when it comes to overall health, then becoming more and more knowledgeable in areas that perhaps you were not trained in optometry school would actually really start to come in handy as we deal with patients at a deeper level. So maintaining good vision throughout life. You can see in this graphic here, this is sort of the idea of what we think of in terms of as we move through different decades of our life, that we tend to, our posture tends to go, the ability seems to go. So, of course, if we can at least maintain our vision, we can still do the things that keep us interested in life, reading, driving, seeing our loved ones, all this is very, very important. So I'm just going to do a poll, and if you could actually just write your answers in the chat, either 1, 2, 3, or 4. So throughout one's lifetime, how important is overall health to good health, eye health, and vision? So number 1, not important at all. Number 2, somewhat important. Number 3, very important. And number 4, not sure. So if you could put that in the chat now, just to see what everyone thinks of that. Okay. Okay. So far I'm seeing a lot of 3s actually. Right. I believe everyone has a similar view on these. Great. Thanks for your responses there. And it doesn't come as any surprise, right? It's something that we know intuitively. Not all of the studies, as I can show you later, actually come up with definitive answers sometimes, but as a general understanding, we know this to be true. Okay, another poll. When it comes to general health, which factors play a key role? Positive mindset, proper nutrition, physical health, or for all of the above? So, some more answers. So, thanks, Elizabeth. Thanks, Marianne. And Zabaya, thank you. Yes. Okay, so 4. So basically you're already answering the questions. We do know intuitively what is holistic eye care and eye health, because We know these things are important, but why? So here's an actual study that looked at this question. Now, because it's really hard to control all of these factors like mindset, physical activity and things like this, it is difficult to do. So unfortunately, there's no one study yet that says, yes, you must do a certain regime to keep your eyes in a certain state of health. But what we can look at is, for example, larger scale studies. So we'll just pull out this study here, which predicted cataract. And the use of multivitamin supplements reduced the risk of developing nuclear cataracts over an approximately 10-year follow-up period. So that's actually quite a long follow-up period time. And importantly, sometimes we also have to look at random controlled trials, because this is truly the most unbiased and highest rating of evidence-based medicine. And it did compare things like antioxidants, like vitamin E, beta-carotene, vitamin C, compared to placebo. And these particular trials randomized more than 75,000 people and followed their outcomes between 4 to 10 years. And again, these supplements were found to have, so in this case here, it's a similar risk. So in this case, as I mentioned, this is hard to take into account. So what do these people actually think and do as well, apart from just take these supplements, and beyond that, their diet? So this begs the question, do we have to wait for a study to tell us exactly what to do, or can we use our best knowledge in and blending other areas of real integrated health to have some of the best advice for our patients? So rather than just saying, supplements, diet don't make any difference because, this large trial, it seems similar, it's very, very hard to control all these factors. So like we said in the poll before, we all kind of know, even though it's not proven, that this is something that we should strive for. But then if there isn't a study that tells us a particular regimen, how do we even get started? How do we know what's right for one person and not another? How do we know what's right for ourselves? Well, we can go into that with a little more detail. So something to keep in mind, so as you all mentioned in the poll, that these different factors actually play a role in our overall optimal health. Mindset, diet, which includes anything that we take into our bodies, exercise and recovery, so how we recover from the exercise. And I'm just going to see here, I think, again, we can put in the chat, has anyone actually tried to optimize all of these factors in their lifestyle? Yeah, putting a yes if anyone has. Yeah, okay. I'm either going to take that again as shy or still listening and finding out. I would say that there is this cognitive dissonance among many of us. So this means we know something is good, but we don't take action necessarily to optimize it. And sometimes it's because we think we do enough, we don't know where to start, we don't know the consequences, the pros and cons. So if you haven't really had a good think through the pros and cons of doing and optimizing all of these areas of life for yourself and for your patients, then you might not be able to make, again, an educated decision on what to do in your day-to-day routines. So let's, again, cover this as we go forward. I wanted to bring across a certain new perspective for you today. If anyone knows what this is, I'll give you a clue. Something to do with lifespan. Okay, so this grid is actually a representation of the typical lifespan of a female in areas such as, Singapore, Australia, where the lifespan is about 90 years. And currently, I'm actually 42, so this knocks out all of this proper section. I've actually already gone through that. This is for myself. Now, a third of the time I'll actually be asleep as well, so I won't be, able to enjoy that side of things. Now, my mother died at age 73, so if I have actually the same genetic predisposition as my mum, I can think maybe I might live to about as old as she did as well. When I look at what's left in life, this is a picture for myself. Now, I like to think of myself as not too old. And yet, when I look at what averages are, right, it's perhaps looking a little bleak. But a question we can actually ask ourselves is, what can I do? And this is the question I have been asking myself. What can I do to, for example, negate certain lifestyle factors so I can live up to maybe the average age of a female in developed countries? And beyond this, is there something I can do to extend that? So add an extra 10 or 20 years to the lifespan. But most importantly, not just to live and stay alive. Because if we don't have fully functional bodies, fully functional minds, it's not a very enjoyable experience. So my challenge again to patients and practitioners is, with the remaining years that we do have left, what can we do to make these rainbow years? Make the most out of them, make them joyous and vibrant and lively and colourful, which is what we hope for each of us. And in fact, there are many things we can do. There is a lot of science around this already. It just doesn't necessarily happen to come under, eye journals necessarily, or within the domain of eye care at the moment. But we can expand this more, and it's up to ourselves how much we want to delve into this area. For myself, I actually think that it's a really important thing, and it's a bit of a learning curve, but it's worth it. So when it comes to the consequences, so chronic diseases and the aging population, actually disease onset is getting younger. Diabetic retinopathy is actually the leading cause of vision loss in working adults, and this is in Singapore. The risk of blindness increases 15 times in Singaporeans aged 50 to 80 years. And of course, we're living older now. So it's predicted by 2050, a quarter of the world's population will be over 60. Now, this may sound like something that seems obvious, right? A quarter of the population being over 60, because, if you divide, an average lifespan, 20 years, 40 years, 60 years, you think about a quarter of them should be above 60, but that's not actually the case. So if you do look at bell curves of populations in the past, there is attrition in earlier years of life. So people are actually continuing to live, right? So these are problems that we're going to have to really delve into. And as eye care professionals, we're in the right position to handle this huge tsunami of oncoming vision impairment. So 80% of the vision impairment currently in the world is preventable or treatable. So again, this is the big call to action that we have to respond to. And when it comes to the individual and how they feel, so visual impairment impacts the mental state of someone, increases the risk of depression in the elderly. So, I can definitely see that as people get older and less mobile, depending on their eyes actually is really important. So I was actually viewing a facility here, a training facility, which combined both optometry and even the nursing department and some of the geriatric care, and I actually had the opportunity to look at the training wards and with a group of different healthcare board members. And I actually mentioned to one of them, I believe that optometry and eye care is an important part of geriatric care. And they kind of, so the other health profession kind of found that a bit strange, or a new concept, even laughable. Like, things like heart health and cardiovascular health and bones are important, but not really vision or geriatric and care. But in fact, I believe it is, because this is actually one of the main things that keeps us going. Physical performance. So we know that self-confidence in children can be affected, just being able to play sports and things like that. Social, the adverse effect on social relationships, being able to just relate with others. I think in a lot of parts of Asia, there's anecdotal evidence that people who have these sort of visual disabilities tend to become very alone. So they become agoraphobic rather than not go out. So vision can affect, obviously, development, physical, cognitive, and social development, economic, reduced productivity, lower employment opportunities, and that actually has a cycle. So it's a negative cycle loop, causing intergenerational burden. So if one set of parents or parent has lower productivity and loss of job, that will affect the future generations of how well they can care for their eyes as well. So the impact really is huge. And this is where I believe, we really need to have a truly integrative approach when it comes to eye health and eye care, where we can take the best of many different disciplines and bring them together to care for the person in front of us. And because of that, I've actually gone and done some extra training in integrative health, where I actually do volunteer to groups about how to take better care of their health and have, again, a holistic approach. And this is something that has been very integral to clinical and patient care as well. So let me just, So I just wanted to bring across to you here. This is actually talking about health and lifestyle. So in this case, there was a study where there was 260 participants, and the participants had a very high barriers to contact lens wear, so 33.8%. And this is actually things like they thought that the students were not suitable for lens wear, and perhaps their eyes were too dry and things like that. So you'd think that students would actually not necessarily have dry eyes at such an early stage. In some cases, actually 64% of the sample, the practitioners thought the lenses were unsuitable. So why am I talking about contact lenses? So contact lenses actually help individuals have a more active lifestyle. And it is something that is very conducive to exercise and just having a very open and free feeling when it comes to living everyday life. And so perhaps if in this case where almost 65% of the patients are being told perhaps they're not suitable for contact lens wear, that is something that we could consider. And why? Because if we're not active and out there, computer vision syndrome is very much a problem in many ways, and it does start in the young. So in fact, even the very young actually start spending quite a lot of time and building that up as they get older. So it's estimated that 12-year-olds spend 6.5 hours of daily screen time. And computer vision syndrome can be related to eye strain, headaches, blurred vision, dry eyes, and neck and shoulder pain. And 90% of employees who use a computer for 3 or more hours a day experience vision problems. And the thing with computer vision syndrome, it also means that people blink less. So they're not aware of it, but they blink significantly less in front of the screen. And this causes a dry eye feeling, which causes an inflammatory response in the eyes, which then knocks out or affects the glands that produce tears. And so we end up with, again, a negative loop where we're getting drier and drier eyes. So having a balance between this modern lifestyle and being able to, again, maintain healthy vision for life is extremely important. Okay. So it's actually been quoted that with an explosion in the use of digital devices, shifts in diet and other likely contributing factors, eye care providers are encountering a veritable epidemic of dry eye. So there's an estimate that it will actually be an epidemic of this as well. So I mentioned earlier what I call the tsunami of vision impairment, but this is also something to be aware of, which is the epidemic of dry eye. Now, let me just see if anyone has any questions. No? Okay, moving on. So when it comes to biological systems, excessive stress is actually not going to be beneficial for the system. So excessive stress is defined as something that exceeds current capacity. It's a deviation from normal performance, so something that we're already conditioned to doing. And excessive stress can be chronic or acute. When it comes to other body systems, sometimes you can actually find that stress may increase performance capacity. So, for example, when we exercise, actually that's a type of stress, a training stress. But because we're actually conditioning the body, our ability can actually uplift each time we expose ourselves to a little bit of training stress. Now, unfortunately, when it comes to the ocular system, stress does not improve the capacity for eye comfort. So you can't just keep looking at the computer and hoping that will train the eye. It actually won't make it better. It will actually make it worse. So many of the factors that contribute to our modern lifestyle, such as I mentioned, the digital devices, long hours, deadlines, multiple devices, and poor ergonomics, increase that excessive stress. And of course, the things that we can control are having balanced hormones, diet and exercise, and movement. So again, it's something that we intuitively know, but how do we get there? I just wanted to share a video of, to share the example of lack of knowledge when it comes to understanding overall eye health. So let me just play this for you. This was just, a pop quiz that I did with some students. Let me show this to you now. I don't know. Apologies for the sound as well, but there are some subtitles for you to read.
Do you know that there are things you can do when you're young to take care of your eye health when you're older? Do you know that?
Yes.
Do you know what to do for your eye health?
Far away.
Okay.
Right. Take a break.
Okay. So, sorry. I just was meant to pause. So I just pause and say that he really has no idea in terms of what to say. And his response in how you can take care of eye health, so you have good vision in later years, is actually to look far away. That's the extent of his knowledge so far.
I don't know.
And who taught you that?
The Optometrist.
Okay.
Yeah.
Do you have a high degree?
Yeah.
Do you mind telling us how high degree?
600, I think.
Has anyone ever told you about retinal detachment? Okay. So maybe just to let you know that this is a condition because your eye is high power, that the back of the retina here, which captures the light, it can actually break away. flashing lights, you need to get someone to help you straight away.
Okay.
Okay, so I'm glad that we were able to tell you that today.
Okay.
Okay, and have you ever thought about contact lenses?
No, not really.
Has anyone ever mentioned them to you before?
Yeah.
Okay.
Yeah.
But why, what have you heard? Why don't you want to try them?
Just more convenient.
Okay. Are there any times when you might want to not wear your glasses? Do you do any activities?
Sports. Can I have?
What sports do you play?
Table tennis, like running.
Wow, yeah, I think it would help.
Yeah. Okay. So a very interesting example. So someone who is -6 myope, so obviously has been having vision correction probably since he was very young, hasn't ever been told about the risk of retinal detachment and what to do if it's going to happen. The warning signs to look out for. I have actually seen patients like this who've experienced retinal detachment and vision loss. Unfortunately, we're not aware that it was, such an urgent medical procedure and left it too long for, full visual recovery. So, having someone to have counseled that to them at an earlier stage. In this case as well, here's a young gentleman who does, table tennis and running, and no one has even offered him contact lenses. So again, it's something to be aware of, that there are many of these types of individuals, walking around the streets of whatever country you're in right now who haven't had this conversation yet, right? And it just takes that one individual, that one eye care professional to take the time and ask them about the activities that they do to figure out what it is that could help them in their lifestyle. So obviously this young man is young and healthy at this stage, but how can we keep him there? What do we need to do to make sure he tends to keep up this lifestyle and have all the best factors to have, that are predisposing him to stay healthy? Okay, let me just move on. So according to the Optometrist and Opticians Board in Singapore and many other guidelines, actually, the recommendations for the frequency of eye examination by patients, by an optometrist or ophthalmologist. So below 16, they should be actually checked annually. And unfortunately, not all people in Asia Pacific and globally have that access to an annual eye check. But at least for those that do, and if we have that ability to have the patients in that chair, we should be letting them know that this is important. In Australia, where I'm from, this is actually something that is actually ingrained into the citizens. We do have a Medicare system where actually every 2 years or in regular periods, depending on the vision needs, there is a covered eye exam. Now I'm going to go on to vision optimization. So, what is vision optimization? This is another young gentleman that I'll share his story in a moment, where, he kind of struggles with his vision a bit. He has an older pair of glasses. He has to see the board by taking photos of whatever his lecturer is showing and zooming in with his iPhone. This is the only way, he can see, but, he hasn't really, been proactive about adjusting his glasses or, again, finding other vision correction solutions. I'm just sharing a picture of today, actually. Earlier today, there was the Singapore Air Show, actually, which was a combination of, different aircraft, military aircraft, and just all collecting in Singapore. It's quite an amazing event. And the reason I'm sharing this, it's to enjoy activities like this, right? You can see here that I'm wearing a pair of wraparound sunglasses. So being able to have that vision correction or contact lenses with, the wraparound, it's extremely bright out there today, very, very bright conditions. And people who were not wearing sunglasses really were suffering and not being able to see and fully enjoy the experience. Let me actually just share with you what some of that actually looked like. So let me play some of the stunts that were done by the air show. Now, these little planes, when they're quite in the distance, they're almost tiny little dots, right? So again, if we don't have visual acuity, that's not going to be the best experience. Again, it's extremely bright. If you have any opacities or glare issues, that's going to be a big issue. And if you don't have your sunglasses that day, the people that are not were really, really suffering. You can see that. So, being able to help our patients out with all different circumstances, so again, that they can enjoy and get the most out of life. Let me move on. Okay, so going back to what I mentioned before, which is we know that, we have different factors when it comes to optimal health. Here's an example. The thing is that a lot of people, they want to jump straight to, I want to lose 5 to 10 kilos. I want to lose 20 centimeters. I want to have lower high blood pressure and things like that. It's not going to happen unless we start building in those, daily activities that we need to do. So when it comes to fueling our bodies, what are things we can adjust before and after we're eating? How can we build our bodies? How can we recover effectively so that we can continue to exercise all day, the rest of the week? And knowing when you're telling yourself the wrong messages, that you may be undermining yourself, right? You may be actually having undealt issues that you haven't fully addressed, and that is stopping you from being your ultimate person. And the person sitting in front of you may be also experiencing this, right? So sometimes, when we have patients who are clearly not healthy, is it our job to actually have this conversation with them? Is there a way we can have this conversation without, being offensive? And I really believe we are in a very good position, because patients will be seeing a number of different practitioners for different reasons, but we don't know how often they see them, what's the relationship they have with them. Is it the role of the eye care professional to cover these topics? Of course, it is up to you how far it is that you want to go. But I believe that more and more we should be covering all different aspects of our patient. And by being that ourselves to begin with, we're in a better position to know perhaps what they're going through. So if we do need to go through any of these transitions ourselves, to have gone through that, then know what it feels like, know what works for you, have done some research. You'll be in a much better position to counsel them and address other issues. Certainly, it should come up in your history taking, things like, your systemic diseases, any medications they're on, give a good indication of their overall health, of course, their history and their genetic predisposition as well, so any family history. But, there's a lot you can tell by just an overall view of your patient. You can pretty much tell straight away those who are, very active and those who are not. I wanted to share an example with you actually about the effects that this can have on an individual. So, this is actually an example of myself. And you can actually see, I do wear it's a wearable technology that measures sort of average heart rate over, every day, but I can get a report as well over a whole year, over different months. Now you can see, so I had, certain stressful events in 2022, right? And you can actually see the average heart rate actually increasing. And I have to take some real positive steps, some research again, going to practitioners that I might not have seen before. And it's a learning curve to know how I can address the stress issues. And of course, stress is something that to the body, we cannot tell if it's internal or external. The body just sees that as a threat. So having that high heart rate actually indicates that there are many factors like increased cortisol happening in the body at the same time. So after addressing that and, addressing thyroid issues and things like that, I'm actually able to reduce the heart rate down to, what it used to be. You can see This is a measure of what we call heart rate variability over that same period of time. And it's almost, you can see, it's almost a mirror image of my resting heart rate if you turn on the side. So whenever, for example, the heart rate is high, the HRV is low. So HRV is a very, very good measurement, again, for how stressed the body system is. And over time, this will be actually, I think, a major test that people do, just as we do measure weight and height to weight ratio and things like that. I believe that heart rate variability will be one of those things as well. And interestingly, this was also related back then in 2022 to my sleep score, which, so when I'm sleeping less, so you can see October and November, I'm sleeping less. This is the overall sleep score I've gotten. The heart rate actually becomes higher. Yeah. But I'm glad to say that, with addressing the heart rate issues, I'm actually able to bring the heart rate back to what I hope it should be. And if you actually look at some of the tables here in terms of targets, the resting heart rate chart. So for women in my age group, actually, I'm fortunate, I guess, that I'm actually well within the healthy range, and you can actually see that for yourself. So if you don't know this about yourself yet, if you don't know this about your at-risk patients, this is something that a lot of the wearables actually are measuring now. So a lot of people are actually wearing, these either as a watch or a ring or some other kind of device that can actually tell a lot about your patients and how to help them. So, so for eye health and overall health, some people think like you're either born, healthier with healthy attitude, or perhaps you're, not of that way. But I think there's a question of the chicken and the egg. So I'm not sure if you've heard of this term before, but, which comes first? You're healthy, so you can maintain a healthy lifestyle, or you actually never get that opportunity. Well, I'd also like to share another example. Are people who are wearing contact lenses just those kind of more outgoing people that like to look that way and feel that way, or are they created because someone did offer it? So let me just share an example here, a case study. So David is a 39-year-old ultramarathon runner. He's a long-standing contact lens wearer. He has bilateral astigmatism. He's a non-compliant reusable wearer, so he does really need daily lenses. He's a high-frequency and loyal wearer, and he also has Fuchs heterochromic cyclitis. So Fuchs heterochromic cyclitis is a type of chronic uveitis where there are sometimes floaters and debris in and around the anterior chamber, and it's actually not very responsive to steroid use. So having, there is actually no treatment per se for this. So potentially, LASIK is out of the question as well, because one of the eyes has slightly lower visual acuity due to this chronic uveitis. So let's just play some audio in terms of his experience. Let me just get this working. Oops, sorry about that. Let's go back in.
Hi, can you tell us about yourself?
Yeah, my name's David, and I've been wearing astigmatic contact lenses for about 10 years. I started off wearing 2 weekly lenses, and I just decided that, look, basically the convenience of the daily lenses means that, I made a switch pretty quickly. And now I can't say I wear them 24/7, 365, but I definitely wear them 7, 365. I put them in as soon as I wake up, and I take them out as soon as I go to bed.
Okay, so in David's opinion, you can hear him that he's actually wearing them almost every day, like almost all his waking hours. For me, he actually says it's an absolute game changer for me, and I would be lost without them. And this is extremely important in his lifestyle, and he's a very active person. So again, was it because he was active first, or was it because someone had actually recommended that to him? So let me just also play this other audio about how his experience was when he found out he had vision correction needs.
You were a teenager and you realised that your vision wasn't as good as it should be. What were your thoughts and feelings? And
Yeah, it was frustrating when I found out, because I remember grabbing a pair of my mum's glasses and putting them on, and whoa, how come everything's so clear? It was a bit scary, actually. And I realised that, wow, what kind of impact this must have had on my life in class. I was about 16, right, 17 when I found out I was short-sighted. Impact on class, couldn't see the board, and it makes sense. And then it kind of scared me, like, what has this done to my sport, my learning, everything like that.
Mm-hmm. So actually this is an AI image, so I'm not sure if any of you have played around with AI yet. This is not actually David, it's a completely computer generated image of someone, because this is, as a young boy, they may have the misconception like, oh, I have to wear glasses now and this is what I might have to look like. So there was a lot of that fear about, I'm a non-glasses wearer and non-vision correction person to now needing it. And the transition that takes, but also the question like, oh my gosh, what have I been missing? How will it affect my sports? Because I kind of like sport, but, can I still play? So,
you're a teenager.
In this case, it was actually recommended for him at early enough stage for him to continue doing the activities that he wanted to do. So back to the question about, is it a chicken or an egg? I think, which came first? It's really, I think everyone has the potential to be outgoing and, optimal, and again, confident in themselves, ideally active, because that means they can have the best lifestyle. And so exercise isn't a burden, but something that they actually enjoy. This is another example of a gentleman who, again, hasn't had the right exposure perhaps or understanding of different vision correction options.
Have you tried wearing contacts before? No.
I heard some people say it's quite uncomfortable.
Oh, so you know from your feedback?
Some of my friends, they tried wearing contact lenses. I heard my buddy, he bought, I know this is like he just bought some cosplay contact lenses for color eyes, right? Or maybe he want to buy the Seafood dark circle of your eyes. He told me his eyes are so sensitive. He want to put it on his close.
The eye feel closing.
Yeah, that is
it's just too scary, is it? When it's something closer to the eye, right?
Yeah, so I don't think I'm comfortable wearing contact lenses.
Okay, so again, to explain this young gentleman, he actually was a very avid Kung Fu fighter. So he's actually learning martial arts. He was kind enough to demonstrate some of his moves later, and he explained that unfortunately he does, lose a lot of his fights. But I wonder, how more confident he could be if he could make the transition to at least part-time contact lens wear. So in this case, for this young gentleman, this is what he enjoys doing now. Is it something he'll be able to continue doing, especially as he gets older? Can we give him all of the support he needs to do what he enjoys doing? He's also a visual arts student, so vision is very important to him. You can see his reservations. So if you couldn't hear the audio, he actually, his understanding of contact lenses is that his friend ordered cosplay contact lenses from the internet and tried to put them in his eyes, but had not much luck. He bought the Sith Lord contact lenses, which I'm sure were also very uncomfortable and perhaps not the best fitting lenses. So this is his perception of what contact lenses are. And again, are we giving him all the details? Are we supporting these young gentlemen? He's had this pair of glasses for 5 years as well. So it's been 5 years since he's even had any kind of checkup. So, you know, as the eye care professional who last saw him, sounds like perhaps they didn't do the best job. Did they not tell him he should come back at least every year, you know, having this high prescription? Should they at least have given him options? Should they at least talked him through, you know, some of the myths about contact lenses and perhaps even given him professional trial? So I believe he's missed out on some opportunities. So, you know, discussion perhaps, you know, if anyone would want to join in and put that, what they would do and recommend for this young man. Certainly, you know, something like, you know, a daily lens would be ideal for him, I think, in terms of getting him to experience what that is. So something which is called lens on eye is a technique where the practitioner just inserts the lens for the patient. And of course, this should be done pretty easily if you're very experienced. You can, you know, put contact lens in almost anyone's eye if you're quick enough, and for them to at least have that one experience, one time where they can see clearly without anything in front of their face, without the frame. You know, that could really change what they know about what their vision is capable of. What are his main barriers and how can we overcome them? So it doesn't take long just to ask the question, like, what have you heard? What do you understand about contact lenses? And, you know, in this case, you can understand the story that he's come up with. As a practitioner, you should be able to easily counter this with, you know, some good examples of what a contact lens fitting should be like. Explain to him that his friend didn't do the right thing when he came to fitting. You should never try it yourself. And in terms of how to overcome them, I think the easiest way is sharing stories. So sharing stories of similar people, you know, with his similar hobbies and how much it helped, for example, in their martial arts or kung fu fighting, giving him the benefits as well. So without fully understanding that, people wouldn't know. So I might just a time fast forward this bit. We can cover this in a future talk. I'm going to go through some molecular mechanisms of eye aging. I'll just share with you that recently I was volunteering in an elderly vision and eye health screening. Now, if you really want to become passionate and well-versed in this area of maintaining lifelong vision, please volunteer in an elderly vision screening because all of them have, you know, some issues, right? Some eye issues. We're talking about 70, 80, 90-year-olds. Almost all of them I saw also had quite significant ARCAs, which is a sign of higher cholesterol. This particular lady, I noticed she had like a nevus, which could potentially be, you know, a cancerous cell later in life, so it needs to be monitored. But yes, but definitely these signs of pterygium, which is related to UV exposure and damage, and this ARCAS, you know, the eyes do not look good, feel good, see good. That's what we talked about earlier when it comes to holistic eye care. Unfortunately, when it comes to the elderly, they're either not in the capacity anymore to take your advice, to understand it, or perhaps it is kind of too late to address some of these issues, but we can always obviously do the best that we can. And it's always better to start as early as we can. But then when it comes to, for example, macular degeneration, it's actually at the level of the retinal pigment epithelium that the dysfunction occurs. And obviously, these are the signs that we see in the fundus photos and the OCTs. And really, by only understanding the pathogenesis of different eye diseases, can we then think about various factors that we can do to address these diseases. Okay, so one big part is actually the mitochondrial oxidative stress. So let me just give a rundown of mitochondria. So mitochondria are located in cells. They're like the little powerhouses of cells. And if we don't take care of them, they're actually going to cause, you know, cell death, this process of necrosis, apoptosis. pyroptosis within the cells. And this is what happens when we see the dropout of nerve fibers in the retina. This is what's happening, and we can see different markers. And in experimental models, we can actually dissect the eyes and look at the different levels of, inflammatory markers that are inside the eye cells. So everything we do, everything we consume, everything we eat, how much stress we add to our body, these are the changes that are happening inside ourselves that we can't necessarily see. So just because we can't see something may mean we're not addressing it. If this was happening on our skin and causing some obvious skin condition, we'd want to do something about it because, it's unsightly. It doesn't, again, look good. But then when it's happening at the cellular level inside the RPE, people are not going to know. People are not going to, again, make that connection between what they're eating, what they're drinking, what they're, how they're moving to what's happening inside the eyes themselves. So it's actually this cell death in age-related macular degeneration that we can see that there's a whole chain reaction of the formation of complex proteins attaching to the mitochondrial membrane and triggering the cell death. So there's a communication pathway that starts and very difficult to stop. So some of you who may be more aware of this space may have heard overall that mitochondria are actually just important overall to general aging. So there's a hypothesis that if you can keep your mitochondria healthy, then you can actually delay aging process overall. And so definitely the link between the mitochondria, which is in every cell in the body, including the eyes, if we can maintain them, then this is going to be something that is beneficial. So one of these, for example, is the longevity signaling pathways. So something like caloric restriction, some of you may have heard of intermittent fasting or just time-restricted eating. So having a window of the day where you eat and where you don't eat, rather than snacking all day long, actually helps to reduce the concentration of glucose in the blood, increase and raising the concentrations of key metabolites. So things like NAD, that people actually do sell these supplements, but perhaps you don't need a supplement. Perhaps the body just needs a break from food sometimes in a restricted way, so that the body can heal itself again. So again, there's a lot of overall research, not necessarily in the eye health space, but this is more in the endocrinology space. But my challenge to all of us now is, can we be more aware of things like endocrinology now, things like understanding how insulin affects the health of the cells, and knowing how to control that insulin level to be able to have, again, a lifelong healthy vision. I'm just going to share an example here of comparing the stressful time, as I mentioned, and what is one of the things driving my talk today is, my mother did pass in 2022, and that caused a very significant stress to me. This is why I want to learn about how I can prevent how, she went in an unfortunate way, I believe, to now something I can learn to help friends, family, my patients and other practitioners. So in terms of oxidative stress, you can actually see the difference in hair growth here. So as I mentioned, if it's on the surface, you would do something about it. And if this is happening in the hair, then what is happening inside the cells of your eyes? It's a question that you need to ask yourself. And can you regenerate again? And I do believe with the right care, the right routines, and the right understanding, which is not just randomly picking things and fad trends, but really looking at, the best in what science has to offer. This is the way we can approach it. Okay, so I'm just going to go on to developing an action plan. And I think what we can approach here is the 7 habits of highly effective people. This actually is such a general and very insightful and extremely helpful 7 steps that have been proven the test of time. And if none of you have heard about it before, it was actually written by Stephen Covey over 30 years ago, but it's still very, very relevant today. And we can actually bring these steps into what we do, such as being proactive, putting first things first, which is how we prioritize and what we do. Seek first to understand, then be understood. Be really inquisitive, be really curious. Sharpen the saw, it means improve our skills, improve our knowledge continuously. And whatever we developed earlier, how can we, make incremental improvements on that? Begin with the end in mind is really setting your goals moving forward. Think win-win. So it's not about always beating others, but actually winning together. And I think as an eye care industry, we can do that. We all take an approach where we're all more holistic and synergizing, which is the teamwork that you have and among your team members. So I'm just going to do a time check for Bruden. Shall we pause for questions?
Sure, we can do that. Or do you have something else to cover for today?
Yep. So maybe I'll just skip right ahead actually, and so we can cover. So I just wanted to point out finally that the first step is be proactive, and I also mentioned about put first things first or prioritize. So one of the techniques to be highly effective is to prioritize things that are not urgent but important. And so things that are not urgent but important include ongoing learning. So what you're doing here today, thank you for joining us. This is an example where we recently had a talk. This is Dr. Jim Kokonakis from Australia, and he actually gave wonderful presentations about eye health, dry eye, and how to care for that. So in the elderly screening I did, the following week, Dr. Jim talked a lot about the significance of dry eye and the prevalence of people who do not have a full blink. So a lot of people have dry eye because they have exposure on the conjunctiva and cornea because they have an incomplete blink. And because I'd not heard this talk before, I hadn't been on the lookout for it. But this lady here, this is me asking her to fully shut her eyes, close them as best she can. And you can actually see because of the laxity of the skin, there's actually a bit of a gap when it comes here. And she was complaining of really, really severe dry eyes. So one of the methods for that is actually to have tape on the eye overnight. And there are specialty tapes that can be more comfortable, I guess, for the ocular skin. Having this knowledge about eye health, you have so much more than the general public. So what you do, what you know, you actually do have a superpower, and you have the potential to impact different people in their lives. In summary, we can plant the seed for healthy vision throughout life. We can start as early as possible to develop the right habits, but you don't want to tell someone it's too late. And of course, even the elderly people, that we see, we don't ever tell them it's too late, right? But we try and give them options, the best care that they can have at the time. Yeah, become a health hero, someone who does live and breathe it, understand it for themselves. And as we go through this series, please join us for a more deeper dive into holistic eye care, when we're talking about looking great, seeing great, and feeling great. I'd love to have you all join for that as well. Okay.
Well, thank you so much, Dr. Shirley, for that comprehensive talk. I think this has been great to know that, we play definitely a very important role as primary eye care practitioners. It's not just about being a great clinician only. You need to be ready for the entire health aspect when you want to talk to your patients and when you're probably telling them about the benefits of healthy lifestyle in general, right?
That's true. That's true. And it can be a bit daunting or scary if we haven't covered this before, or if we're not truly that ourselves. And so, this is a bit of encouragement for everyone to step outside their comfort zone if they have not yet already.
That's right. Yeah. So to the attendees, just wanted to, remind that there is a series of talk which Dr. Shirley is going to talk about, and they are planned on the last weekend of every month. So we are going to have a monthly discussion about this particular topic, because we have heard a lot of clinical talks. We have learned about case studies, but then I think this is something which is unique and kind of I think sometimes it also comes like a soft skill when you start seeing with experience. You kind of learn it along the way, but I guess it should be from day one you start seeing your patient, rather than coming it as a soft skill in the later by years of your career, right?
That's right. And we can go into some techniques about how to approach patients in the right way. Mhm.
Wonderful, great. One of the question I think which came into me was, I think you did answer it in the last conversation, is somebody wanted to know how would be the best or an effective way of incorporating all these thoughts when we are doing the management or doing our conversation with patients. So any strategies, maybe you can give a bit of highlight on how would you convey the message to your patients.
Mhm. Yeah. So I'll put it back to the audience first. That if you have, a heart condition and you go to a cardiologist who is clearly not healthy, will you trust them? So I think it really starts from ourselves, like challenging ourselves to be as healthy as we can. Because if we need to go through a process where we improve, we know the challenges that come to ourselves, how hard it might be, the barriers that we may encounter. So I think living and breathing is really important. But that said, I think start with the lower hanging fruit, which is, someone who clearly does not meet the look good, see good, feel good criteria, right? There's something clearly not right with them. They're here, and you're in an ideal position as an eye care professional to spend time with them, have a deeper conversation, explain that the questions you are asking them is to help them, improve their vision. So they understand why you're asking all these questions, And the thing is, a lot of practitioners wouldn't have asked it, so it may come as a surprise to them why getting so deep into this. And this is where examples can help. So sharing previous patients that you may have helped. But if it's the start of your journey and you have helped that many patients with this kind of conversation yet, then you really have to jump in the deep end a little and just have some faith. Hopefully, the series will kickstart that process for you. But it's never too late to.
That's right. And I think you did also bring an important point in terms of working together with other healthcare professionals. We are talking about optometry and ophthalmology, but then we want to work together with other healthcare professionals, cardiologists, speech therapists, vocational therapists, and things like that. Somebody was asking that, would you recommend any 2 or 3 to begin with? I mean, is there any personal choice which you think that we should start with these 2 or 3 healthcare professionals and then go on to do more? So do you
Yeah, I think introducing.
some tips on that?
Yeah, I think it's breaking up a little bit, but I would say that you need to know your local GPs in their area, introducing yourself, writing referrals to them, even if sometimes you don't get a reply. Just coming and visiting them maybe and sharing like what it is that you do. If you do have better equipment in your practice, slit lamp or something to visualize the posterior of the eye, let them know that you do have this equipment available. If they have diabetic patients, for example, they want have a little bit of more of an investigation, help with that process. So I think that a GP is a good starting point.
Wonderful, great. Yeah, I think they wanted. Sorry, I was lagging, but I guess somebody wanted to know which 2 or 3 healthcare providers would you want to start with or begin with when you are into practice. I think you did tell that GPs, general practitioners who are in your locality, telling that you do fundus examination and things like that to refer diabetic patients, and that would be a great starting point. So thank you so much for that. Yeah. Any idea on counteracting contact lens barriers? Because I think you had that one patient who had, I would say, inappropriate or incomplete knowledge about contact lenses from the peers. So any thoughts on that? How would you counteract that?
Yeah. If you genuinely care for the patient, I think they can feel that. So some of us worry we come across as hard selling if we're trying to suggest something. But I'm pretty sure if this young man, if his mother or father was an optometrist and he's doing Kung Fu, I'm pretty sure he'd be wearing contact lenses because they would have fitted him by now. But so we need to have that same approach. Like if you were the guardian of this individual, like what would you say? What would you like to share with them? And again, if you've got some examples, that would be helpful because they can actually hear how other young people like themselves were also scared. My patients are usually very scared of putting in their eye for the first time. Let me do it one eye for you. You can just feel how it is. And it's that initial hurdle, I think, and just letting them know I'm going to be there and walk you hand in hand through the process. You can ask me questions at any stage. And it's just a trial. I think the other thing that young people really respond to is this fear of missing out, right? FOMO. So it's like, if you never try in your whole life, you won't know what you're missing out on. So give them that encouragement as well.
Wonderful. Great. So thank you. Thank you so much, Dr. Shirley, for enlightening us with this aspect. And I think we'll be eagerly waiting for your other sessions as well over the next couple of months. So I think we have taken most of the questions. Some of them came in directly, so I was not able to kind of put it on the chat. But thank you so much for sharing your expertise with us and spending your Sunday evening with us today.
And thank you, everyone, for joining.
Yeah. Thank you so much, everyone. And thank you so much, everyone, for joining today. We do have session planned over the next couple of weeks. We will be sharing the details. Take care, be safe, and hope to see you during the next session. Bye-bye.
Bye.
Thanks, Dr. Shirley. Bye.
Bye-bye.